Okay, we're back, and we have with us Bill Hammett from Hammett Health Insurance Services. Welcome, Bill.
Thank you for having me.
Great. So tell us a little bit about Hammett Health. What do you do at Hammett Health?
Hammett Health is a full-service insurance agency. We do all the boring health insurance, dental, vision, life stuff for individuals, Medicare folks, businesses. My focus is on business, small business in San Diego, and healthcare reform especially.
Yeah, well, a couple of years ago, I would have agreed with you that it was boring and we just had to do what we need to do. Today, with all the healthcare reform in there, something tells me it's not so boring anymore.
It is a change a minute. This administration is making sure that we are reading every article every day because there's changes all the time. 35 delays so far.
35.
Wow.
35, yeah.
For a small business, when do we start? Is it 16?
It already started. It started, the law was passed March 23rd, 2010, and a lot of provisions went in then. Next round provision went in September 23rd, and they kept rolling in January 1st of every year. The biggest changes were January 1st of this year. So we're 2.5 months into the biggest changes.
I must be asleep. I'm not feeling it.
No, you'll start seeing it for businesses. You've heard all the...
Then I'm a business.
Yeah.
All the hubbub was about people losing their insurance plans, right? January 1st. Those were individuals.
Mm-hmm.
You're going to hear the same exact things from businesses when they come up in their renewal in April, July, December. A lot of people, we moved 70% of our businesses to December 1st renewals.
Are a lot of carriers pulling out?
No. In the individual market, Aetna, United Healthcare pulled out of the market. They didn't want any part of it.
Right.
But the group market has got all the players still in there. Lots of products, a lot fewer products. But as we renew, as your business comes up for renewal, that's when you get hit with it. I've got clients that are getting 100% increases. They get deductibles that went from $2,000 to $4,000, and it's the same price. But it's doctor networks are getting cut big time. So it's not apples to apples. It's not apples to oranges. It's apples to ostriches, I call it. It's just so much different. And you got to look at all of it because the rating factors have changed so much. People with families are getting rated for every kid in the family.
What do you mean rated?
So used to be there was 4 rating tiers: employee only, employee plus spouse, employee plus children and family. Now it's every person in the family. You got a 45-year-old employee, their 55-year-old husband, and their 3 kids at 19, 16, and 12. Every one of them has their own individual rate. So the ones that have families, 2, 3, 4 kids, they're the ones that are getting these big, huge increases.
Right. So it's getting tougher and tougher to get those risk adjustment factors down to a minimum. They're hitting you on that too.
Well, risk adjustment factors no longer exist. So it used to be at the 2 to 50 employer market, you could have a swing of 10% discount or 10% load, depending on how big, young, healthy, whatever you might have been. All that's gone. There is no more incentive to be young, healthy, or active. The price across the board.
Hey, I have plenty of incentive to be young still, okay?
Yeah. It just ain't the health.
It's not happening.
I know.
Exactly.
So.
Well, the latest delay had to do with the employer mandate. What's going on with that?
So July 2nd of last year, Obama delayed the employer mandate for 50 plus. And that was going to go into effect January 1st, 2015. 50 plus employers have to comply, have to offer benefits. The latest delay was for the 50 to 99 size groups. So they've got, if you're 50 to 99 employees, you have until 2016 until you have to comply with the mandate. And even then, if you've got a plan year, so if you've got an August renewal, if you meet certain criteria, you can wait until August of 2016 to comply with the mandate. I was reading some analysis of that delay, the 227 pages of that Treasury guidance, and actually, you're not free from penalties. If you're a 50 to 99 business and you have any one of your employees goes to the exchange and gets a subsidy, that's a $3,000 penalty times every person in your business that gets that subsidy.
Wow.
How do they track that? I mean, do they have systems today?
Section 6056 of the Affordable Care Act is the employer reporting requirements that they haven't come out with those details yet. But employers are going to be required to basically let the IRS know their tax ID, the name of each employee that's covered, how much you cover of their benefits, how long they've been on the plan. You have to give a duplicate document like this to your employees. And so what we're working on in our agency is creating that document proactively so that our clients
Right.
are not reacting. Reacting to healthcare reform is a whole new employee. That's a $50,000 a year problem. Being proactive with it is the name of the game.
How
Yeah.
much
You know,
time have you had to spend in getting acquainted with this law and what it means so that you can be the expert that you clearly are right now?
Well, if you're familiar with Malcolm Gladwell and Outliers, he's got the 10,000 hour rule. And so I'm about 10,000 hours in, and so I'm a master of this, like the Beatles were when they first came out.
That's more than 3 man years.
Yeah.
If you're working 60 hours a week.
I just truly, I'm truly passionate about this business. My mom and dad are both insurance people, and I think it's so much fun to try to know more than the next person. And truly, the fear motivator is my clients come to me and they expect me to know the answer,
Yeah.
and so I need to know the answer.
Now,
Yeah.
let me ask you something.
Go ahead.
Because I'm an advisor to small businesses, and the small businessman was trying to get away from being at the 50 category, but at least when I was called on to be part of the consulting team, I encouraged them to get into the 50 bracket because at least you have certainty. You know, apparently the rules are changing all the time, so maybe that's even not there. But what are your thoughts
Well,
on that?
I would take it back. I would say, start with the question of why. What are you trying to do? Are you trying to? Some employers are trying to keep their doors open and can't afford to pay for benefits. Then you want to stay under 50. Some employers are right around 50 and they're paying for benefits that are affordable and their minimum value and all that kind of stuff. So they're not really going to be as affected.
Well, when we were doing it, we pounded the numbers, and yeah, it cost a little more, but just a little more, and you get certainty,
What certainty do you are referring to?
financial certainty,
That you're
that you could project and you could price, you go into your business model and make it work right.
Yeah.
So it does involve raising prices, but it's basis points.
Well, if certainty is what you want out of your benefits plan, define contribution. So instead of this 50%, 75% of this plan or that plan, we're going to do $350 or $500. You can buy medical.
Yeah, that's
vision,
what we
any
espouse.
portion
That's
of it.
what we advocate.
And then now you have predictability in the plan. Or we're going to pay for all of it. We want our employees to have health coverage. So we're going to pay for their plan, not the Cadillac plan. We're going to pay for the Honda. If they want to buy for their family, they can buy down to the Kia.
They can upgrade to the.
Or they can upgrade
yeah.
to Cadillac with their own money. But empowering the employee to make those decisions for themselves with their own money, and allowing the employer to offer benefits without having to become uncompetitive with what they do with the widgets that they're making.
Yeah. You're listening to Close Up on San Diego Business here on KFSD AM 1450 and financialnewsandtalk.com. I'm your host, Barry Waxler, here with my co-hosts, Andrea Kay and Al Arias, and our guest, Bill Hammett from Hammett Health. So, yeah, we used to fight that battle all the time between whether do you want to go defined contribution or defined benefit, and those rules are all changed now. So,
Yeah, I mean,
but it sounds like the strategy is defined contribution.
it is now. Just a few years ago, it was defined benefit. You wanted to work and cover the employer. Now you got to really focus on covering the employee.
Yeah. Well,
No, but that way you cover the employee and the employer.
I get it. Yeah,
So it's
sure.
really strong.
I tell you, one of the biggest changes we've been going through with the employer-broker relationship is we are now we must be militant with paperwork. It used to be if you didn't enroll in the plan, okay, fine, no big deal. Now everybody must enroll or decline every year because the Department of Labor is not going to come looking to be on the employer's side. They want to know that you got all your paperwork, all your ducks in a row, back to proactive versus reactive. And we want to make sure that we have paperwork on everybody. If somebody declines benefits, they're not eligible for a subsidy in the individual market. They think they are. They could get it because it's self-reported, but they owe that money back. When they get that subsidy, the Department of Labor comes to the employer and says, hey, prove that you offered this plan.
Well, you know what, Bill? Let me have you address something for our listeners because I think this is really key. How many the people? I don't think the people really know out there. With all this healthcare reform, if you can go out and get subsidies, it's not a given. You can get the subsidy, but if you're not in the right field or if you're not doing it the right way, they can come back and collect that back from you. Am I correct?
And
So-
penalize you.
Yeah.
Subsidies.
Oh, just wonderful.
Subsidies are self-reported. Okay, so it's an on your honor system, and that's actual Treasury guidance. They said on your honor, you can get free money, right? And when you file your taxes, if you made $85,000 but got $7,000 in credits, and you're a single person, you owe all $7,000 that back. So instead of getting a $3,000 refund check and you can go buy a big screen TV with, you owe $3,000 or $4,000. So that's the scariest part.
Yeah.
The other scary part that people don't know about is if you're an employee and you have a family, so me, my wife, and a couple kids, if my employer pays for my insurance but nothing for dependents, the dependents are not eligible for subsidies, even though they
Wow.
have to pay 100% of the employer cost or the employee cost, dependent cost with the employer. So they are not eligible for subsidies, and that's going to be the biggest uproar later on. I'm surprised it hasn't been a bigger uproar yet. But if your employer pays for part of you but nothing for your family's not eligible for subsidies.
Yeah, this also almost reminds me of when the mortgage industry came out with the option arm loans, and everybody was so keen on, buying a house and paying less than the interest charge to keep it, and just look what happened to the mortgage industry from there. I think you got the same thing coming in health insurance.
Mm-hmm.
So.
Absolutely. Yeah, I mean, it's just education. It's just knowing what we talked earlier about the noise. Cutting through the noise and working with a broker that knows what they're doing and knows their stuff on this business. That'll keep you safe. If you try to read the internet and just Google your way to your best health plan, you're gonna have some trouble.
Yeah. So, and now you're the former president of the San Diego Association of Health Underwriters, correct?
That's right. Yeah, that's an industry that the national chapter represents over 100,000 people. We take annual trips to Sacramento and D.C., and we meet with congressmen and legislators and help them pass responsible and fiscally sustainable reform policies. Obviously, our negotiation skills are very poor because we failed the business community.
You know what? Dealing with the legislature is really frustrating because I do this for the CPA profession. And so you go in and you talk about the problems, and they say, yeah, they know about the problem. For example, businesses are leaving California.
Mm-hmm.
Yeah, we know that. The wealthy are leaving California. Yeah, we know that. Well, what are you doing about it? Nothing.
Yeah, well, it's good to have somebody that has your voice in Sacramento or somewhere else. But
yeah, because now that everybody is aware of all the problems, and there's your voice, I think, might carry more weight at this point.
I hope so. Yeah.
So, well, we're running short on time. Bill, before we go, tell our listeners how they can get in touch with you.
Best way is our website, HammettHealth.com. That's 2 M's and 2 T's. HammettHealth.com. There's a great healthcare reform section that gives you all the information free. You don't have to sign up, and we don't spam you with Viagra ads or anything to get information. We want to give the information.
Isn't that free now with healthcare?
We want the information. Our business strategy is give the information away for free. Be the expert, and we believe that will win us the day more often than not. So the website's good. Our phone number is 619-668-2378. That's my direct line, and we're in La Mesa and local San Diegans.
Great. Well, I highly recommend hiring a qualified broker to manage your benefits. And from what I can tell, we don't have any more highly qualified people than Bill Hammett. So
No.
Thanks for being with us, Bill.
Thank you.
Great. So you're listening to Close Up on San Diego Business, where we get up close and personal with homegrown San Diego businesses and the people that are working to make a difference in our community. This is financialnewsandtalk.com. I'm your host, Barry Waxler. We'll be back next week with more homegrown business close up. And all I can say is thank you, Andrea, Al, and all our guests today. And stay awesome, San Diego. We'll be back next week.